Hi, Mr. Jones. My name is Charlie, and today I'm going to be your student nurse. I just wanted to take a few minutes to explain one of your medications that you're going to be receiving today. It's called mannitol. You'll be getting this through your IV, and it's specifically being used to help with your acute kidney injury, or what we call in the medical field an AKI. I just wanted to let you know, in case you keep hearing us say AKI, you know what it means. Right now, your kidneys aren't making as much urine as they normally should, so this can cause a fluid to build up in your body. And essentially what mannitol does is it helps by increasing the pressure in the kidney's filtering system, which encourages your body to make more urine and helps remove that extra fluid. To explain this a little bit more simply, mannitol is what we call a hypertonic solution, which means it's very concentrated. When it enters your bloodstream, it's going to pull out fluid out of your body's cells and tissues and bring it into the bloodstream so it can be filtered by your kidneys and then leave the body through your urine. That process can help the kidneys essentially wake up a bit and start working more efficiently. It doesn't affect your blood sugar, which is great because you have diabetes. We'll still be monitoring your blood sugar as always though. But we are going to keep a close eye on your fluid and electrolytes, such as sodium and potassium, because shifting fluid like this can sometimes cause imbalances. We'll also be monitoring your labs and your vital signs and your urine output very closely while you're on this medication. There are also a few safety steps that we take when giving mannitol. First, we're going to check the IV bag for any crystals before we start, because mannitol can form crystals if it gets too cold. So we cautiously keep this at a controlled room temperature, never frozen, and if we need to, we can warm it safely. But we never put it in the microwave. We also use a special filter needle to draw it up and an inline filter during the infusion to make sure none of those crystals enter your bloodstream. Now, you may be wondering, why am I telling you all of this? Well, I just want to make sure you're aware of these extra safety steps that we go through in order to ensure your safety. We'll also keep an eye on the IV site while it's running, because mannitol can be irritating to the surrounding tissues if it leaks outside of the vein. This is something we call extravasation. And since it's a strong solution, we also will be checking for any changes in your mental status or alertness as an extra safety measure. So overall, mannitol is being used to help support your kidneys and hopefully get your urine output back to normal. It's a helpful medication, and we're going to keep monitoring you very closely while you're on it. As always, you can ask me any questions you have, and again, you will be receiving the medication called mannitol. Do you have any questions for me so far?